Good afternoon. I'd like to call to order the Health and Human Services and Aging Committee and/slash reception, Wednesday, November 30th, 2022. We're currently 1:05 p.m. Can you have a roll call, please?
Good afternoon, everyone. As a reminder to all in attendance, this meeting is being recorded and live streamed on the county's YouTube page. Calling the roll, Ms. Conwell.
Present.
Mr. Sweeney.
Present.
Mr. Miller.
Here.
Ms. Stevens. Ms. Stevens is absent. Ms. Turner.
Here.
You have a quorum.
All right. Just to make a motion to approve the absence of Councilwoman Stevens. Is there a second?
Second.
Okay, it's been moved by Conwell, seconded by Turner. All in favor, please say aye.
Aye.
We do not need to excuse for committee meetings. We just do as a courtesy. Anyone signed in for public comment?
Yes, Lou.
Hi, good afternoon, everybody. Nice to see all the Health and Human Services directors are here. This is the important part of our county. Health and Human Services are actually the most important part, but unfortunately always been compromised with decreased funding. So they can be understaffed with overload working. And this is the reason why it will trickle down to all the people actually receiving services. So you can imagine the quality of the services sometimes are not there. And this is the reason why it creates a situation not unique in our county. People are either forced into homelessness or jail, county jail. Why? Even we have so many people trying to do the hard work here. All the limits there, all the politics around. The people having a heart to do the real good job cannot really get things done. But the people having some certain interest, they can have the influence in to steer the resources away. So now, today, in the hell, the so-called conference room is leaking now. That's just great. Holiday season is here. Everything is usual again. Please tell me, these two last public shelters we have to help people out, why they cannot be demolished and to rebuild in order to fully help people, well, not fully, at least more than halfly, to help people to actually serve the purpose, to actually fulfill all these hardworking people sitting here, their heart to take on their positions, not leaving their positions for us. Thank you.
Anyone else signed in?
I'm sorry, that concludes the public comment portion for today's meeting.
All right, thank you. Next, we will start with our presentations. I'd like to say thank you very much all for coming. This is a new way of doing business as we transition into new administration that is coming in. So hopefully it will continue for years to come. Health and Human Services is very important to all of us in this room. It's very important to my colleagues as well as myself up here. We know this is a very important mission to the county, is what we do for our residents as well as our employees. So I thought that this would be, since we're going into our third transition with the new executive, that we do something a little different and put ourselves on the forefront for them to understand what we do every day. So we're not going to get into any of our specific issues that are going on within our issues, but an introduction and an overview so they know, how important each of your work that you do on a daily basis on behalf of the citizens of Cuyahoga County. So we will, I would like to start before we do the department head off to please ask the administration, part of the new transition team administration, to come up and introduce yourselves, because this meeting was basically put not only for the residents of Cuyahoga County, but for your new administration.
Good afternoon, through the chair to the rest of the, sorry, can you hear me now?
Is the green button lit?
Yes, it's on. Okay, sorry
right.
about that. First time, I apologize.
That's
First of
okay,
many,
you'll
probably.
learn.
But through the chair to the rest of the committee, thank you so much for having us here today. My name is Eric Whoopser. I'm a member of the transition team, And we are really grateful for you bringing us together today and this overview of what's happening in Health and Human Services, and look forward to a continued partnership as we move forward into the administration next year.
Thank you.
Yep.
Anyone else from the administration side?
Hi, everyone. To the chair and the rest of the committee, thanks so much for having us. My name is David Rosum, another of the co-directors of the transition team. So thank you.
Thank you.
Good afternoon, Chair, and through the chair, the other council members. I'm Sabrina Roberts. I am co-director of the transition with my colleagues, and I also am very well familiar with HHS. I have grown up in HHS for 28 and a half years. So thank you for having us.
Thank you. Anyone else? All right. We'll bring up David Merriman, the administrator of HHS, to get us started. Welcome.
Good afternoon, David Merriman, Director of Health and Human Services. I will be brief. First, I want to thank you, Councilwoman Conwell, as chair of this committee. You've shown great leadership and interest and investment in our services, and we just count on you as a partner as we continue to develop and evolve our response to community problems. Do want to just quickly acknowledge that today we've brought forward our shared service organizations. They will not be making a presentation. We're going to focus on the programs and services. But I think at times we probably assume that council understands our structure. We've had an opportunity to do some overview with the transition group on what that structure is, and I should just ensure that you have the same information. So first, to begin with, our fiscal office is led by Kathy Starks. Kathy is not here today because as the county fiscal year winds down, Kathy is focused on making sure we can get as many invoices and checks through our process before the end of the year. So Kathy is back at the office, really working with her team to ensure that they're responding to as many invoices as possible. In the audience, we have Deanna Kirkpatrick. I'll ask Deanna to stand up. Deanna is our communications director. She manages all communications, community engagement, and she has staff that have deployed into each of the departments and are kind of a shared service resource as we think about how we communicate our programs, our services, how we hear back from the community on our needs. They've done some very outstanding work with creating teams that go into community events to do eligibility, social media presence. I think just a very dynamic group. Next group I want to focus on is our performance evaluation and innovation. I think Dan Humphrey is in the room. Dan leads this group where they do everything from program evaluation and monitoring. They do data analysis and business intelligence development, as well as explore new programs and initiatives that will be innovative and help us design new services. And lastly, I want to just call out Marcos Cortez. You know Marcos. Marcos leads DCAP, the Division of Contract Administration and Performance. DCAP manages the contracts, procurements, and program management responsibilities that don't fall under fiscal, don't fall under PEI. And Marcos is here representing the departments on a weekly basis. I should actually also acknowledge Sabrina Roberts, who has served as our assistant director for some time. Even though she's in a transition role, she's not in the role right now, she still manages two critical groups that have significant size and scale. The first is our training department, led by Brenda Payne. Brenda leads that team. They train our staff, they onboard staff, they train foster parents, they participate in training of child care providers. They're located out of 98th and Lorraine, and they provide really an outstanding service to new and existing employees. And then lastly, Arnell Hurt. Arnell leads our shared service group that does customer care, investigations, hearings, and child care licensing. And under normal circumstances, Brenda and Arnell would be reporting to Sabrina. I think at times each of you have probably heard about their contracts and services. They're not here today, but I do want to represent them. So final point, I do also want to acknowledge who we are and what we do will be presented by the 8 departments that will be coming forward. There are many other partners and relationships that should also be acknowledged. Some of these are aligned systems like Ohio Means Jobs. As I think many of you know, Ohio Means Jobs is a direct partner of JFS. We procure and manage youth workforce services. And I think over time, we have developed such a strong relationship and have a shared commitment to providing quality workforce services to young people and adults alike. You know, we can't do what we do without them. Another example is of a partnership is Say Yes to Education. I know they'll be presenting at 3 o'clock today. It's another area where together, I think we are trying to align systems. In that case, the school system with children and family services. There are many of those. There's too many to go through right now. But I want to say that we see ourselves as being a part of the community. We see our role as leveraging our resources and carrying out our services. But we also know that we can only succeed when the community steps up, and they're our partners as well. And they are contributing, and they are helping us to really redesign and create new and better responses to services. So with that said, I want to say thank you to the chair and to the committee members, and I'm going to turn it over, I think, to the first presentation.
I would just like to let all of you know that we plan on a little reception after. I know sometimes time constraints happen, so if you're thirsty or would like a snack in between while we're listening to the presentations, you can go over to the committee room right next door. And they're cold beverages. So first, we would like to bring up Division of Cuyahoga Job and Family Services, Director Kevin Gowan. Welcome.
Good afternoon. Again, thank you, Councilwoman Conwell, for putting this together. It's a unique opportunity. I really appreciate the ability to do this today and everybody taking the time to listen to us. Do I have I have a presentation.
The presentation is up and you can, thank you.
Thank you very much. So I said we're Job and Family Services, obviously a division of Health and Human Services. And we promote economic self-sufficiency and personal responsibility for families and individuals by providing access to jobs, benefits, and other community services. We are a crucial component, if not the crucial component, to the safety net of social needs that help residents who are facing poverty meet basic needs. We are, I think I should point out, especially to people new to HHS, a state supervised and county administered program. Most of the rules that govern us are set by the federal government. The state supervises and ensures our compliance with those rules, but ultimately we're a county organization. These are the major programs that we administer. They are all federal programs, federally funded programs. For medical assistance, there's the Medicaid program. For food assistance, the Supplemental Nutrition Assistance Program, commonly referred to as SNAP, formerly referred to as food stamps. Cash assistance, now referred to as Ohio Works First. Child care or publicly funded child care. Emergent needs, our Prevention, Retention, and Contingency Program. And finally, employment and training, which are essentially work supports in meeting mandated employment and training requirements that are federal mandates for both the SNAP and the OWF cash program, as well as child care. With me today, well, one person's absent, but I brought my senior team with me. Paul Bounds, if you'd stand, Paul. Paul is in charge of our work and training programs. Chris Freck, he's in charge of our eligibility centers. And Christy Nichols could not be with us today. She is our deputy administrator over the Medicaid program. In terms of access to services, we have several options for people to access our services. There is the self-service portal that is run by the state of Ohio, benefits.ohio.gov. We have the eligibility contact center displayed there that's open from 8 to 4. We partner with local library systems, the Cuyahoga County, the Cleveland, and the Shaker Heights public library systems. We do still receive paper applications through the Neighborhood Family Services Centers. We can also, all that paperwork is also available both through the state website and through our own website, the Cuyahoga County website displayed right here. We'll accept email applications or any sort of documentation people are going to submit through email, which became a little more prevalent during the pandemic. Several options depending on what you're looking for. For most programs, it's that first email address up there. PRC is separate, as well as our long-term care we've set up separately. We have an entire division set up for long-term care Medicaid for those people who need to take advantage of nursing home and waiver programs that are available. And obviously, you can send traditional mail at 1641 Payne Avenue, the Virgil Brown Building, which is our headquarters. And I should note, the Ohio benefit system is available 24/7, or at least it's supposed to be. It does go down occasionally. I have no control over that. In terms of eligibility, just to understand what the program is about, again, federal requirements, federal regulations around this, again, with state supervision over that. But all of our programs are means-tested programs. We look at the means that people have available to them and whether or not they qualify for the program. This is all based on the federal poverty levels set by the Department of Health and Human Services at the federal level. It changes every year, easily accessible online if you're interested. I have a copy with me today in case anybody actually asks me because I don't have it memorized. But in terms of our population, so of the four major programs I have listed here, the biggest by far is Medicaid. 451,000, roughly a third of Cuyahoga County is on or receiving Medicaid assistance. That is significantly, and not to get into current issues, but I feel it's relevant at the moment, that is significantly inflated because of the pandemic. So that those rolls were at 380,000 roughly prior to, in February of 2020, we were around 380,000 people, and it's increased by that much. That is a statewide trend. That is not particular to Cuyahoga County, but it's now at 450,000 and still climbing slowly. SNAP is what, 207,000? That is not inflated. That's roughly what it was prior to the pandemic, maybe a little bit lower, actually. Childcare was impacted by the pandemic. We have 18,000 people roughly on childcare at this point, and it was affected by the pandemic largely in that in March of 2020, childcare centers closed. And they've had a lot of trouble recovering from that. And I'm not going to steal Shauna's thunder because she'll talk a little bit about that, I imagine. But that's why those rolls were in the 28,000. It's significantly lower than it was prior to the pandemic. And finally, TANF, we have around 12,000 individuals. I'm referring to the OWF cash program there. Just a brief note about the community impact of our agency. Obviously, I just went over the size of the population that we serve. We do have the largest population of any county in the state of Ohio with regards to our programs. But obviously, insurance coverage for over 450,000 people. SNAP assistance, we send out SNAP benefits to the tune of $50 to $53 million a month. That goes into the local economy, obviously. That is another number that's actually inflated by the pandemic. Our rolls are not up, but benefits are. The federal government made maximum benefits available. The state of Ohio took advantage. That will eventually go away. When it does, you're going to see it be more around $30 million per month. So it's a significant impact. Just going to get everybody prepared for when that does happen. And obviously, we do work and training for benefit recipients in the SNAP and TANF programs. And I'll talk a little more about that later, but in support of the local economy. A note on where we're at right now. In response to the pandemic, we did go remote, and most of our staff is remote right now. We're able to accomplish that by really setting up a virtual office. Prior to the pandemic, all of this technology was in place except for the secure VPN connection the state made available in March of 2020, or I should say April of 2020. But our remote workers are able to access the eligibility system to determine eligibility. They're able to access client documents. We do not have a paper file room. We have a digital file room. We have a system that we did homegrown to handle work distribution so that we prioritize all the work that comes into us on a not just daily but hourly basis, quite frankly, so that we're making sure that the priority cases get sent to the workers and they simply pick it up in their home office. They also, at the start of the pandemic, they were actually on their personal cell phones in order to respond to the pandemic. We've since then contracted for a much more robust contact center that allows them to have a phone that works over their computer. And also, when we got that piece of technology, we also finally were able to record all calls. So we do record all calls coming into the contact center. We have real-time reporting in terms of that work. That work distribution system gives the management team a real-time understanding of where we're at in terms of pending applications out there, what work still needs to be done, what's done on a daily basis, how productive workers are. And we have the Cisco management, Cisco phone system to manage the phones so that we can tell how many people are on, how long they're talking in real time, as well as regular reports. And finally, I want to make a brief word about employment and training, it's a little more specific. One of the things everybody should understand regarding our employment training programs, they're, at least at the state and federal level, designed to meet mandated requirements. If someone receives cash assistance, there are many exemptions, but if they don't meet an exemption, they're required to perform or to be in a work or training activity for a certain amount of time. And significant, 86, 134 hours, depends on the circumstances of the case, how much they're receiving, but it's a significant amount of time. We have to offer them supports to get them into those activities. It's referred to as the work participation rate for us. It is a mandate of welfare reform from 1996, if I'm remembering my dates correctly. And so I think it's important to note that most of the employment training that we engage in is in service to that program. There are other ways which I'll talk about in a second, but it is a overwhelming responsibility for us when it comes to employment training. The SNAP Employment and Training Program, Cuyahoga County actually has a slightly, I'll say, unique approach. There are other counties who are doing it, but we've embraced it a little more than everybody else. First of all, SNAP Employment and Training can be volunteer or mandatory. Most of our people who are enrolled right now are voluntary. There are waivers in place right now that make the mandatory piece a little muted, so it's not, there aren't penalties associated with it. But the voluntary program, we've engaged in what we call the SNAP 50/50 program, where local vendors put up or local workforce providers provide 50% of the funding for the people that we send to their programs, and then they get a federal reimbursement of 50%. The nice thing about this program is there's no limit on the vendors. We currently have 7. We're expanding that most likely next year. And it gives us a wide range of opportunities, of really career opportunities to put out there for our clients. We also run, in conjunction with the Ohio Means Jobs department that David brought up at the beginning of the presentations today, we run the Summer Youth Employment Program. We routinely serve roughly 1,000 youth throughout Greater Cleveland. And we work in conjunction with OMJ to procure those services and work with vendors to provide a meaningful youth work experience. That brings me to Ohio Means Jobs. We have a memorandum of understanding with them. We work with them. They do have some county staff. Ultimately, their director and much of their staff report to the city of Cleveland. We run also, aside from summer youth, the CCMEP program for older youth, and that involves TANF funding. We also refer some of our SNAP E&T clients to Ohio Means Jobs, and we have some shared staffing. We have a unit of people who work directly with the Ohio Means job population. And that is the JFS programs, and I'd be happy to entertain any questions or move on quickly to the next person.
All right. I think we have a lot of presentations, so I'm going to ask my colleagues if you can just write your questions down on the side, and we can turn them in to the directors. And for the directors, I would ask that, you show courtesy and stay and hear all the other presentations. Thank you very much.
All right. Thank you very much.
You're welcome. I'd like to call up Division of Children and Family Services, Interim Director Jacqueline Fletcher. Welcome.
I will echo Jacqueline Fletcher, Division of Children and Family Services. I will echo what everyone else has said. Just thank you for this opportunity. It's greatly appreciated to be able to highlight the great work that HHS does across the county. So for me, as one of the largest child protection organizations in the state of Ohio, protecting kids and families, helping families connect to resources for over 100 years. I thought I'd use some of my time here to bring some key team members with me to really showcase and highlight the organization's impact and what this really means to our county and the health of our citizens. And so with me, I have Keisha Singh, who's one of our supervisors. I do have a PowerPoint that they'll go through. It's very brief, but I have Keisha Singh, one of our supervisors, awesome, as well as Guillermo Torres, another supervisor, Brian Stanton, who's an interim senior manager with the agency, as well as Stacy Jackson, who's also, child protection specialist, awesome as well. So if I can, I will turn it over to them, and they will run through some of the highlights of the agency.
Hi, everyone. As Ms. Fletcher said, my name is Keisha Singh.
Ms. Singh, I'm sorry if you could speak directly into the microphone.
I'm sorry.
Thank you.
Hello, everyone. My name is Keisha Singh, and I'm a supervisor with the Division of Children and Family Services. I would like to briefly talk about who we are. And who we are is Cuyahoga Proud. We are very proud that we get to do the work that we do. We are a dedicated bunch. Last year, 40,000 calls were made to our hotline department, which operates 24 hours, 7 days a week. That's close to 140 calls per day, and over 12,000 referrals were accepted for investigation of suspected child abuse. We believe in partnerships. We have a world-renowned team decision-making model that includes critical collaboration between agency staff, parents, community partners, and juvenile court to achieve safety and permanency for children while strengthening and stabilizing the family unit. And finally, we offer services, a range of evidence-based therapeutic interventions geared to support child safety and family stabilization, including many specialized units like our START department, where staff are trained to support parents in need of addiction treatment. Thank you.
Thank you.
So the impact, when we look at the children we serve, we currently have 2,300 children in agency custody. On average of the month, we are looking at doing 300 placements, whether they be kin, residential care, or foster care. At any given time, less than 5% of the children that we're looking for placement end up staying in our building because of lack of resources. 95%, but that shows us 95% of the children that we are looking for placements are matched and same-day placements. And of the 2,300 children, 866 are in permanent custody. And as of 10/31/22, we finalized 145 adoptions and found forever homes for children. Thank you.
All right. Now, we've established the quantity of work where we're being tasked with, but I'm here to talk about our community partnerships because as an agency, we really are blessed and in a good position. We have a really strong infrastructure of established partnerships. As soon as that phone rings at our agency, we have the ability to service families from that point. And I kind of broke out the slide. We have two different tracks. We have families we work with that are in-home services. These are cases where the families may be struggling with some things. However, at least the children are safe in that home, and we can work with them to try to rectify their situation so that they, don't have to continue to be involved with our agency. We also have services for the families that unfortunately are in a situation where they're just struggling and the children are no longer safe in that home. Those kids need to be removed. But regardless of your status with our agency, we have services in place. We have partnerships in our community, and we have a really strong collaborative approach because, again, these are our families. They're our most vulnerable families. They need to be served in their own communities. And no one worker can do that alone. So we really do partner with, we have a supportive services department within our agency that can provide intensive in-home services, counseling, lots of things for our families. We also have community-based services, which we have 13 sites throughout Cuyahoga County. And these do work, they do intense work with our families. They also do a lot of preventative work. And the important thing about them is that these families can get served properly in their own communities. They don't need to come down to our agency. These are families that are struggling with things, resources, transportation. We can service them properly in their own community with the help of our community. We're a very threatening agency sometimes. We have the ability to remove children. Sometimes that leads to the community not, wanting to work with our agency as much as someone else, someone more friendly, more strength-based. That's where our community partnerships come in. So we have strong partnerships with them. We also do a lot of work with our other HHS agencies here. We do that with them as well as with our community, and that's the best way for us to serve our families. And as well as, because of our established work, we also recently have a grant that we've been selected by the Harvard University. They have a government performance lab. They are working with us to tighten up our preventative services so that even before families come to our agency, we can still service them. So we have partnerships with our school districts, our local hospitals, as well as our community partners. And we're all going to be working this next year on really finding ways to better serve our families in their communities so that they don't even need to get a phone call to our agency. We can work with them before that even begins. So that's it. And then again, we also have, for our out-of-home programs, we do a lot of work with our network providers. They provide the foster and adoptive homes for our kids. But we also have strong programs within our agency. We have our own internal foster adoptive program, and we also got another grant through the state that is going to work on us to increase our treatment homes. You may hear a lot of times when kids come into, there's been some stories in the press about kids staying in our building. Those are kids that have some significant needs, and those are higher level placements. So we now internally have our ability to increase that program so that we have more homes to provide them, which will lead to even less kids having to stay in our building. But basically, again, it all comes back to working together. We can't have one worker spend all this time to correct these problems that these families are struggling with. Some of them are generational. Some of them, there's just a lot of layers to it, and we need to really continue to partner with our other agencies as well as our community to do our best to service them in their own communities. Because not only will the families do better, but so will our communities as a whole. So, thank you.
Every child deserves and needs a family. And when we are unable to return our children to their families, we look for other entities to provide that love and support for them. If it's through adoption or if it's through legal custody to a relative or interested individual, we work with our community providers and families to provide a safe family unit for these children. We limit their time that they are in our custody by making sure within 18 months, if they're unable to go home, that we provide a permanency plan for them. They could be adoption, legal custody, or a residential facility if their needs demand such level of care. Thank you.
Thank you again for the time to share just a brief overview of the organization. And if you guys have questions, we'll be happy to take them afterwards. Thank you.
Thank you. Division in Senior and Adult Services, Interim Director Natasha Petricola. Welcome.
Good afternoon, and once again, thank you for hosting us this afternoon. I'm going to share a little bit about the Division of Senior and Adult Services today, and hopefully I'm very long-winded, so I'm going to stay right on track for the 10 minutes I've been allowed. But the only reason I speak passionately about DSAS is because it's such a necessary service, and I'm going to provide some statistics and data that kind of goes and proves that that's definitely the case in our county. So, the mission of the Division of Senior and Adult Services is to empower seniors and disabled adults so that they could age successfully and remain independent and in their homes. And obviously, with that, as we age, some people need some support built around them. It is much less expensive to maintain somebody in their home and their natural environment than to look at long-term care. So we're dealing with an aging population. That's a trend that's pretty much nationally being pursued throughout the country. We know that in Cuyahoga County alone, by 2030, 31% of our population will be over the age of 60. The number of people we know every 20 years increases by every 20 years doubles those people with dementia. And obviously, part of that's in relationship to the fact that people are growing older. We also know that within 20 years, 85% of the population over 85 will double. We know that older adults are outnumbering younger children at this point in time. We know that 1 in 7 seniors are impacted by hunger. And we know that oftentimes there are decisions that have to be made in our senior population between whether or not they're going to afford food, pay for rent, medications. It's a continuous battle about how they maintain their budgets and are able to just survive in the community. We also know that loneliness is as impactful as smoking 15 cigarettes a day. So it has a profound effect when people are isolated, and we've seen a lot of this as a result of what happened with the pandemic recently. And we also know that bankruptcy is a huge issue economically across the country, that we see a surge in people over the age of 65 who are filing for bankruptcy. It is 3 times what the numbers were in 1991. This slide kind of talks about the demographics with the Division of Senior and Adult Services. If you look at our agency as a whole, our budget is a little under $21.6 million a year. We have, when we're fully staffed, about 151 FTEs. So it's a smaller agency, but we do powerful things with the staff that we do have that are very passionate about the work that they undergo daily with the seniors we serve in Cuyahoga County. If you look at the race statistics, it's pretty much equal among African Americans and white clients that we serve. We see a much lower decrease in those that we serve from the Hispanic population and also others. Gender, disproportionately, it tends to be more female, but life expectancy with women is typically longer than with males. But we do have about 67% of our clients that are female, about 32% are male, and then 1% are other. There's also a breakdown between the city of residency. If you look at the statistics, about 53% of the people we serve are in Cuyahoga County proper in the suburban areas, and then the other 47% are in the city of Cleveland. And as far as age demographics, you'll notice that 42% of the clients are between the ages of 60 and 74, 29% between 75 and 84, and then we have about 21% 85 plus. And then since we do service adults that are 18 to 59 that are disabled, that's where you will see that under 60, we serve about 8% of the population. This is just a plot graph. So if you look at Cuyahoga County as a whole and the services delivered, each one of those plots on that graph represents the area that we're servicing a particular client with a particular program at DSAS. Again, just some trends with numbers I thought it was relevant to share. We did see some decreases in 2020 semi-annually if you look at the numbers, but I can honestly say that we've seen an increase in volume with the majority of our programs, especially those calling into our Connection Center and for the individuals who are also looking for short-term case management through our Information Services, which is our Aging and Disability Resource Center. These are the clients count served and what we project will 2022 result in by the end of the year. Like I mentioned, our intake department was 6 staff at the beginning of the year. We've added 4 additional social service worker 3s to that division. The numbers are insane. We project that we'll get about 24,500 calls of people just looking for resources this year through our hotline. So the magnitude of the volume coming in, if it's something that DSAS cannot assist with, we provide people resources, we connect the dots, and we get them to those service delivery partners that really can benefit whatever the need may be of the person who is calling us for help. Again, I'm not going to go too much into detail, and the PowerPoint has been provided to those that you can reference at a different time. So we still continue to recover from pre-COVID kind of numbers and program delivery. 2020 hit us extremely hard because one of the most vulnerable populations early on with COVID were the senior population. They were very susceptible, and they were quite honestly the group that are most impacted and were dying from contracting COVID. So we have seen an uptick, like I said, in the programs as far as those that we're servicing. The needs remain kind of consistent, but I also think the economy is kind of impacting what we're doing as well. We're seeing a lot more calls for food. The benefit of being at DSAS is we have an on-site food pantry. So if we have a client that's calling that needs something to help them get by for the month, we make sure that we pack them a hearty bag of a few groceries to take them. Our call center, we are, like I said, projected to hit about 25,000 calls this year. It has not slowed down during, the winter months, so I pretty much think that that's a realistic kind of outcome. The top things that people are calling for, believe it or not, are utility assistance, homemaking services, and home-delivered meals. And that's outside of when people are calling for adult protective services. So it's very important at DSAS that all the programming and the development of services that we are looking to provide the citizens of Cuyahoga County really focus on the social determinants of health. We have recently this year engaged in Age-Friendly Cuyahoga, or Livable Cuyahoga as we termed it in our agency, and that's going to be looking at the 8 domains where people really are impacted by situations that hopefully we can put some programming around and develop some resources to ensure that people receive equitable health care, have fair housing, that there's socialization available to them, and transportation, social connectedness. It's an endeavor that is actually hosted out of our Office on Aging department. My executive officer, Patricia Newell, wasn't able to join us today, but the Office on Aging does a lot of programming with the community, and they also have the Community Social Service Program underneath them, which provides grants to various agencies to provide programming, and they also have our network of senior centers that they work exclusively with. So one of our key programs at DSAS is Adult Protective Services. We investigate all allegations of abuse, neglect, self-neglect, and exploitation of Cuyahoga County residents, regardless of demographics. We are the largest adult protective services program in the state of Ohio. We have 30 APS social service workers, and we have a very robust adult protective collaborative that meets every month to talk about difficult cases. It is attended by hospital networks. All of them are included in that. We have legal experts that attend. We have guardianship services. So we really get an opportunity to talk about some of the most difficult cases of older adult situations that we may be witnessing in the community. We also have a behavioral health unit that came about in April of 2020 because we had clients who needed geriatric assessments, and quite honestly, nobody was getting an appointment. And capacity is very important when you're dealing with older adults and their ability to remain autonomous and make decisions. Those are just some breakdowns about the numbers of who we're seeing, and predominantly it's self-neglect. Those are the most reported incidents. Then we have our Information Services Unit, which is the Aging and Disability Resource Center. In a nutshell, that program is the one that's the safety net. If you don't qualify for options or APS or home support, you probably fall in this category. They work with those 18 to 59 disabled, 16 older. We have a benefits checkup system. We're able to run numbers to see what our programs people are eligible for to help them survive in the community and also get some relief if necessary. Then we have our clinical-based programs. We have a home support division. Right now we have 6 nurses. They perform some skilled care. They go out into the homes. They supervise our family service aides. The family service aides provide the personal care and the homemaking that many of our clients who do not qualify for Medicaid, passport, or waiver can engage in that program. We have options for independent living. This, again, is a program for those people that kind of slip through the cracks. They don't qualify for Medicaid necessarily, but they don't have ample amounts of resource to provide for, paying services on their own. And they do 5 core areas. They provide a life alert system. They provide personal care, homemaking, home-delivered meals, and also transportation to medical appointments. Our Community Social Services Program is where we host all of our contracts that we provide to various senior centers and other outward-facing senior servicing programs that do things such as adult day, home-delivered meals, programming for seniors on their sites. They do congregate meals, transportation. They really work towards alleviating social isolation. And that budget is about $3.6 million in contracts that we provide. And then I'm open for questions afterwards, so I will move on for the next person to come up.
All right, thank you, Director.
You're welcome.
All right, next we will hear from Community Initiatives Division, Family and Children First Council, Director Robin Martin. Welcome.
Good afternoon.
Good afternoon.
As my colleagues have said, thank you very much for having us here this afternoon to talk about the various programs we provide for children and families in our community.
Ms. Martin, if you could speak directly into the microphone a little bit louder. Thank you.
Is that better?
Yes.
The Family and Children First Council was formed in 1993, and it is a state and local partnership, and the purpose of it is streamlining and coordinating government services for children and families. The actual council is made up of the directors of all child-serving public systems in Cuyahoga County, and our office serve as staff to the process. We are responsible for 2 areas. Our primary area that we're known across the state for is service coordination. We are one of the largest Family and Children First Councils in the state. And under service coordination, we provide prevention services for families. And this year we launched an outward-facing portal on our website where families, schools, hospitals, and community agencies can submit questions or actually do referrals online, and we can help navigate them to the appropriate public systems and respond to their needs. We also are known for our efforts to prevent families from relinquishing custody in order to receive services. That is a philosophy across the state. It is our goal to never have a family feel that they have to give up custody of their children to get services. And we have a lot of families across the state of Ohio who have in the past given up custody of their children to receive residential treatment. And we have mechanisms in place to prevent that. We work alongside the new Ohio RISE program, which is a state initiative that is operated through Medicaid, and the vendor is Aetna. And we have 3 care coordination agencies in Cuyahoga County. On the west side of the county is Ohio Guidestone. In the center of the county is the Positive Education Program, formerly PEP Connections. And on the east side of the county is Ravenwood. And we work with them. It's given us an opportunity to serve more families than what our small office can service. And then we also provide wraparound services to families across the state through state funding of various funding streams to help make sure that kids remain in the community. Throughout the year, we serve about 400 kids. We have a smaller group of deep end, what we call deep end kids, and those are the children that are at imminent risk of removal. They're typically involved with the Department of Children and Family Services, the Juvenile Court, the Board of Developmental Disabilities, and the Adams Board. And the parents, a lot of times by the time the parents reach us, they have gone through several years of struggle, and they are requesting removal, and we try to work with the families to either keep the child in the community, in the home, or do a short-term residential stabilization period, and then transition the young person back in the home with a plan for services on how they would maintain their child in the home. In addition to the work we do for service coordination, for service coordination, the children are 0 to 21, and we consider them multi-need, multi-system involved children. On the other side, and I have Kathy Tomasic here with me today. I manage most of the service coordination, and she met.
Ooh, you okay?
You okay? Okay. I manage most of the service coordination, and she manages youth development. And under youth development, we partner with community-based organizations to serve children kindergarten through graduation. These kids do not have to be involved in public systems. They just need to want to participate in programming. And through that, some of the programming we offer, we have an expansion for out-of-school time. Typically in Cuyahoga County, through federal and private funding, we have about 10,000 slots for out-of-school time, but through the funding we provide, it adds an additional 3,500 slots for families so that their kids are safe, because there is a gap between when our young people get out of school and when our parents get off work, and those are that's the high-risk time for our young people to be in the community. And through these programs, we're getting 3,500 more youth into a stable program where they're participating in positive activities versus being left to their own devices. We also have programs that promote youth engagement, that focus on youth voice, advocacy, leadership, and service. And through those programs, the young people, we specifically in one of our programs look for young people that are not engaged in other school-based programs. So they're not the captain of the football team, and they're not on student council, but they have something to say. And we work with them to help them find their voice and to become advocates for their peer group. We also provide programming that supports social, emotional well-being of young people. We want to make sure that they're exposed to opportunities across the county. And we have programming to aid in closing the achievement gap for students. And lastly, we engage parents so that parents who may not have been involved in what's going on with their child's day-to-day academic program, we try to re-engage the parent around 3rd grade to get them connected to the school so that they feel comfortable having conversations with school personnel. And it also creates a go-to person within the district so that if their children have problems in the future, they have a person that they can connect with to address those issues. We work with several school districts, not all of them because we're a small group, but we work with about 15 to 20 school districts across the county in various programs. And we pick up where the Office of Early Childhood leaves off. So they are, and I think Shauna's next, they are birth to kindergarten. We are kindergarten through graduation, and we have some overlap in the kindergarten because we want to make sure that our smallest citizens are prepared to start their academic career. Thank you.
All right. Community Initiatives Division, Ohio Office of Early Childhood, Shauna.
Good afternoon.
Good afternoon.
Shauna Rorman. I'm the Interim Director of Invest in Children, also known as the Office of Early Childhood. Thank you, Councilwoman Conwell and the HHS Committee for having us today. With me today is my Interim Associate Director, Alyssa Swiatek, who also is our family engagement expert on staff. Here we go. Briefly want to start with a little bit of history and overview of Invest in Children. It was created in 1999, actually at that point called the Early Childhood Initiative, developed by community leaders who recognize that all children deserve supports during these critical early years of life. This is a public-private partnership that focuses on prenatal to kindergarten period, so 0 to 5, as Robin mentioned, and the prenatal period in Cuyahoga County. We are staffed by the Office of Early Childhood in county government and have been since 2004 when the office was created specifically for that purpose. We are the first, if not only, county level office dedicated to the entire 0 to 5 continuum. Our mission is to mobilize resources and research to ensure the well-being of all young children in Cuyahoga County, provide a continuum of targeted services prenatal to kindergarten for children and their families, build awareness, advocate, and measure our impact. We aim to achieve equity in access to services and eliminate racial ethnic disparities in child and family outcomes. I wanted to share a couple of slides to sort of ground us in sort of the larger importance of the work that our office does. One of the key statistics that you will hear in relation to early childhood is that about 90% of brain development occurs by the time a child enters kindergarten around age 5. So that's the blue line at the top. This stands in contrast to how public dollars are typically spent across childhood. So this graph shows that less than 10% of public dollars spent on children are dedicated to that 0 to 5 range. Given what we know about brain development, it makes sense that when we invest in those early years, that provides us the largest return on investment. Prenatal, early childhood, 0 to 3, and the preschool years give us the biggest return across the life course in terms of dollars that we invest. And so these facts are part of what motivates our work. Not only should we invest in children so they have every opportunity, but also because the investments pay off in the long run. Really briefly on our staffing, we are a small but mighty team. When fully staffed, we are 9 with a fiscal agent who reports over to Kathy Starks. Our 2023 budget is about $20.5 million. Most of that comes from HHS levy funds and our generous taxpayers, and about a little over $1 million from grants. We follow a lead agency model where we contract with 7 lead agencies to deliver and administer programs and services. So those are the logos at the top. And on the bottom, we never want to forget that we also partner with 73 preschool providers as part of our Universal Pre-Kindergarten program, and also partner with the Case Western Reserve University Poverty Center for all of our external program evaluation. So our work falls into 3 key programmatic areas: child and family supports and services, early childhood mental health, and early childhood education. I've included for you our numbers served in those 3 broad categories over time. You can see, if you do a little bit of math on the side, pre-pandemic, we're serving anywhere from 9,000 to 10,000 families and children per year. During the pandemic, that dipped to about 6,000. Because a lot of our services are home visiting, you can imagine that the shift in modality to deliver those programs really drastically impacted the number served. And as Kevin mentioned earlier, the impact of the pandemic on childcare has been pretty dramatic and continues. We are seeing the numbers increase, but it's been a slow climb, especially in the city of Cleveland. 2 other things I want to mention here before I dive in. We also fund the child fatality review process, which goes through the Cuyahoga County Board of Health, and we have a staff member on our team who sits in on all of those meetings. And then we are also very involved in work around lead screening and testing in the community, sort of at the advocacy level, partnering with the Lead Safe Cleveland Coalition and many other organizations and entities doing that work. So this first area, I'm going to zip through these a little bit quickly, so I apologize in advance. I want to be respectful of time, but you have the slides. So in this larger child and family supports and services area, we have newborn home visiting through the Cuyahoga County Board of Health as well. This is a one-time visit by a registered nurse to eligible first-time and teen moms in Cuyahoga County. This is a primarily serving moms insured by Medicaid. It's a one-time visit. It happens within 6 weeks of the birth of the child. But in that one visit, they do a comprehensive assessment of mom, of baby, and of the home to see if there are any issues that need to be educated or referred on. And so most of the time, a lot of the time, things are normal and great and just educating on anything that the family may need, but there are also times when the nurse catches really important health issues and is able to refer the mom or the baby to receive services that will prevent that from escalating. We had one case not too long ago where a mom was having really severe hypertension, and the nurse was able to get her immediate assistance, which saved her life. So one visit, but very impactful. Our Moms First program is through the Cleveland Department of Public Health. So this is a program that serves moms in the city of Cleveland. It aims primarily to serve Black moms in the city of Cleveland with the goal of improving birth outcomes and reducing racial disparities. Participants in Moms First have much better outcomes than the Cleveland average, especially in terms of infant mortality. So this is a program that may have a smaller footprint but has a really big impact on the families that it serves. Bright Beginnings, we are funding their parent support department. This is new this year. So for many years, we've funded Bright Beginnings to deliver parents as teachers, which is a home visiting program. They have been able to shift that funding source and receive funding from the Ohio Department of Health. And so starting in 2022, we are pleased to support the expansion of their parent support services, which includes expanding their already existing online community for parents, Cuyahoga Parents Connect. They will be implementing a parent support-led program, which supports families whose children ages 3 to 5 have elevated blood lead levels. In our system, in terms of lead, that is an area where there is not a lot of systemic infrastructure to help those families and especially help those children. Triple P, an evidence-based program that offers practical strategies for everyday parenting challenges. And then throughout all of their programming, Bright Beginnings is moving toward having a substantial fatherhood component to tie all of those together. So we're really excited about all of that. Spark is typically referred to as an early literacy program, but it is really a program whose goal is to prepare children and families for school and to prepare schools for children. So they partner with the schools in the areas that they serve. They work with the children, and they also, the home visiting model is sort of modeling great teaching strategies to parents so that parents can become their child's first and best teacher. So they do early literacy, early numeracy as well. We have really great evaluations for the Spark program, showing that they make gains, kids and parents make gains during the program, and the kids perform better on the kindergarten readiness assessment than the rest of their district typically. And then our newest program, sort of under this umbrella, is Family Space. This is a multi-agency collaboration with United Way of Greater Cleveland as our lead agency. Our locations in both Cleveland and Cuyahoga County Public Library Systems, and Family Connections as consultants for training and staff development. This is a family-led, in terms of programming, a family-led, a community-led space for families to come, and it's unstructured. Bring your young children. It's a space to connect kids with kids, connect family members to each other, families to each other, to really learn. And there's a staff person there for any questions or resources that those families may need. So it's going so well so far. I could talk way more about that program. We're really excited about it. Early childhood mental health is our sort of second area. Two kind of bigger programs here. One is our early childhood mental health system, led in partnership with Invest in Children and the Adams Board. We co-fund this program. Adams Board subcontracts to 8 mental health agencies. These are typically in-home services, but are also can be office-based, and some have been virtual, obviously, during the pandemic. We are seeing a huge need in terms of early childhood mental health issues, a lot of social emotional, a lot of attachment. Our biggest issue here is workforce challenges, so a long wait list, a lot of challenges around the workforce. The PIPS program is implemented by Starting Point, and this is a sort of a corollary to the early childhood mental health program in classrooms. So it's not specific to emotional and behavioral issues, but also any physical accommodations that children may need, with the goal of keeping children in their classroom so we don't have to move them somewhere else to accommodate them. We want that consistency. We want to keep them where they are. And the last area of our work is in really amping up the early care and early childhood education system. We partner with Starting Point for all of this work. They are the backbone of our child care system in the county. So a couple of our contracts focus on improving access to child care, whether that is center-based or family child care, improving the quality in those centers, and professional development for the staff in those early childhood programs. And lastly, our Universal Pre-Kindergarten program. This is our sort of flagship program built on an existing system of high-quality preschools, mixed delivery model with Head Start, center-based, family child care, and public school district preschools. The two sort of key, well, there's 4 components. Again, another thing I could go on and on about. I'll highlight 2 things. What's happening in the classrooms is Starting Point deploying professional development and coaching, not only around improving the quality, but also around engaging with families. It's a huge component of Universal Pre-Kindergarten, and it is one of the things that the teachers tell us they love the most. The other component of this is improving access for families through scholarships, 33% and 50% scholarships depending on income. This is another program with great evaluation results. Essentially, kids who go to UPK do better than their counterparts when they get to kindergarten, and even some evidence that they're doing better in 3rd grade. So I will leave it there. Thank you so much for your time.
Thank you. Next, we have Community Initiatives Division, Office of Homeless Services, Director Melissa Sirek.
Good afternoon, Council.
Good afternoon and welcome.
Melissa Sirek, Director of the Office of Homeless Services. Thank you also for the opportunity to be before you today and give you a brief overview of our office and share with you some of the great accomplishments that we've had this year. Not sure how to work this. Bear with me here. Okay. Did I do something wrong?
There you go.
Oh, there we go. Okay, thank you. The Office of Homeless Services was established jointly with the City of Cleveland and Cuyahoga County in 1993. We have a 28-member advisory board, and we're responsible for coordinating federal, state, and local funding for the continuum of care. There are really 3 prongs that I think are important to mention of responsibilities that we have. First and foremost, to Cuyahoga County, we have the responsibility for approximately $10 million in levy funds for the procurement, contracting, and monitoring. In addition to that, we are also in partners with the City of Cleveland in facilitating a procurement process for them as well for their Emergency Solutions Grant funds. The second prong includes serving as the lead agency for the homeless continuum of care. Part of that responsibility entails that annually we are responsible for a HUD application for approximately $34 million, and this is a year-round process. I should also mention and back up one moment that we are an office of 4. Many of you know, small but mighty, and I'm extremely blessed, before I get into all the great work that we do, to have the 3 individuals that work beside me. So I'd be remiss if I did not mention that. So as the lead agency, we're responsible for planning year-round for that application that is so critical to the services provided within our community. In addition to being the lead agency, we are responsible, as I mentioned, for serving and leading the continuum of care. The continuum of care is inclusive of any agency within the community providing homeless services, and that includes approximately 40 agencies and over 200 programs. Also, as the lead, we are responsible for the convening, coordinating, and strategy to end homelessness in our community. What does that mean, though? So just to give you some few examples of what the daily looks like for us, that could be anything from convening and leading the conversations to provide a COVID response with our community partners in the healthcare system. It could mean on the daily that we're discussing our family overflow shelter and that it's full. And what is the response to serving these families and what is the overflow to the overflow? It also means that we could be working with the correction system on how do you appropriately release an individual so that they're not ending up at 2100 Lakeside. It also means convening a seasonal shelter plan year-round. So these are some of the daily conversations that are so critical and have the impact within our community. The third prong is that we are responsible and designated as the lead homeless management information system, which is also known as HMIS, which is our centralized database that is used by all of our continuum providers. Oh. What am I supposed to press? This one? Sorry. I'm not technologically savvy. Okay. Bear with me. We do good work, though. So that's what really matters. So as we look at HMIS, these are some of the main pieces that are so critical and important for our office to provide. One of our 3 staff is the HMIS system administrator. And just to make this a little bit more real for you, what that means is he is responsible for all of the data collection, the data quality, the technical assistance, and all of the data reporting that is provided at a national level. So what that looks like for this individual is there are approximately 200 end users of this system that is used in live time. So as individuals enter our shelter system, they're entered directly into that database, and you can see in real time where the referrals are being made and their process throughout going from unhoused to housed. Any technical issues with this database, he is receiving that phone call from the 120 users. In addition to that, there's monthly reporting that is checked for data quality, and we are a highly data-driven system. So this makes this position and this responsibility so critical to the system because that data is used to improve workflow. It's also used to secure funding. HUD views this as the Bible. So data is only good as the input that you're putting in, and it makes it critical to securing that $34 million in that HUD-NOFO application every year. So 2 important pieces, just as a reminder of what I just mentioned about that, is just remembering the importance that this system is live. It's a live database. It's not after the fact. And all the data is used for system evaluation and improvement and to secure funding that makes this role ever so critical. As I mentioned, HUD is an annual application that takes us all year to prepare for. Each year, they identify priorities and principles that really overlay all and underscore all of the work that our office is responsible for. In the 2022 application, there were 9 priorities that they outlined. Priority 1 was ending homelessness for all persons experiencing homelessness. Priority 2 was to use a housing first approach, and we'll talk a little bit about that in a bit. Priority 3 was to reduce unsheltered homelessness. Priority 4 was to improve system performance. Priority 5 was to partner with housing, health, and service agencies. Priority 6 was to advance racial equity and address racial disparities. Priority 7 was to improve assistance to LGBTQ individuals. Priority 8 was to engage persons with lived experience of homelessness. And priority 9 was to support local engagement to increase supply of affordable housing. So Cuyahoga County's continuum of care is not flawless. However, it is one that is collaborative, effective, and looked at as a model in other communities. And there are several key philosophies that are rooted in our work. The first is housing first. We believe that any individual has the right to housing, and if it provided the appropriate supports, they could be successful in being housed. And at the front of our system is what we call the Coordinated Entry Program, which is the front door to entering our shelter system. Anyone seeking shelter contacts Coordinated Entry. From there, our first approach, as you'll see on this slide, is to divert the individual from entering shelter. Ultimately, we don't want them to have to enter our system. Through that process, individuals are screened, mediation is provided, maybe they can go back to family or friends. If shelter is inevitable, they proceed further with a housing plan, housing barrier screen, and then an appropriate shelter referral is made. It is also important to mention that in our continuum of care, we are one of the few continuums that do not turn individuals away. We will shelter anyone that shows up on our doorstep, and that is not the same for every community. As I mentioned, we make appropriate referrals, and we'll do assessments for each subpopulation. We'll get to that a little bit when we look forward and some of the work we've already done this year. The second philosophy that's rooted in our work is client choice. We believe that just as ourselves, any individual or family experiencing homelessness has a right to choose, has a right to choose in services, has a right to choose where they live, has a right to choose their journey along the way in becoming housed. Lastly, two more philosophies. We believe in being low barrier. So everyone should have access to shelter. There's no need to be clean or sober. Programming isn't mandated. And our ultimate goal is just to provide easy access to shelter and services. Our last philosophy that's heavily rooted in our work is our progressive engagement model, which is demonstrated here. Quickly, just in mentioning, we believe in matching the right resource with individual based on their barriers. So the higher level of barriers, the higher level of resource that we'll provide. And when you look at the progressive engagement model, when we look at housing assistance, for instance, rapid rehousing rental assistance, we believe in providing someone a base level of assistance. And as we walk beside that individual, we provide them greater assistance and extend that assistance as needed from their journey from unhoused to housed. Wanted to mention just a quick few data points. I didn't do a deep data dive. That could be a whole nother meeting, and we're definitely open to it. Looking at our 2021 data, we're currently in reporting for 2022, so I used 2021. Just some highlights. In emergency shelter, we have provided emergency shelter to over 4,700 individuals in 2021. We have provided emergency shelter to over 300 families. Yes, I'm sorry, and provided street outreach services, which is inclusive of anything from providing hygiene items to linking them up with shelter, to just doing basic linkage with resources to over 200 individuals. There should be one slide in your packet as well that I'll cover. When you look at statistics within our system, we do have an overrepresentation. 70% of individuals are African American or Black that are entering our shelter system. Our average range right now, the majority and percentage of individuals in shelter are between 30 to 50 years of age. And over 50%, probably not surprising, are experiencing either a mental health or addiction issue and concern. When you look at our 2022 budget, this diagram here, I appreciate because this kind of gives a quick overview of what resources really funnel into our system, allowing us to make all of this work happen. You'll notice that 67% is from HUD and COC. That is the $34 million application that we're responsible for every year. Followed next by 23% from Health and Human Services levy. So critical. Their three top areas for levy support are to provide a basic safety net for our homeless community. There are three priority areas of the continuum that are supported by levy, including emergency shelter, overflow shelter for singles, families and young adults, and supportive services. The levy dollars are very important to maintain basic, safe, accessible shelter for those households experiencing the housing crisis. And then these funds are then leveraged with other federal, state, and private foundation funds to meet the community's needs. Dollars to provide rental assistance to help households leave shelter quickly are awarded through Cuyahoga County through the Department of Housing and Urban Development, Continuum of Care competitive grant process, and these funds cannot be spent on shelter, making the levy funds even more critical in securing that safety net. Looking following then, we have roughly 5% from the City of Cleveland for ESG, 4% from state ESG and trust fund, and then 1% through the county ESG. I wanted to briefly, as I round home here, mention some of the great work that we've had when we think of impact this year and take this opportunity. First and foremost, I want to mention that you'll see here, race, equity, and inclusion is at the center and the core of what we do. We have moved from it being philosophical and a theme to this is the work that we do, and it is ingrained in the work that we do. So I chose this graphic here because that is the lens that we'll view all of this work through. We've made several strategic efforts this year in regards to race equity. First, I think important to mention is the upgrade and reinventing of our master RFP, which needed to be revamped. It was rewritten, the scorecard was redone to be more inclusive and focused on diversity, to ask the organizations, what is your diversity plan? How is your board currently sit, and what is your plan to improve that? And what is your plan to incorporate individuals with lived experience, whether that be in employment or in your decisions? We also, just to mention one other, we also looked at our advisory board and say, how are we addressing diversity here? In that process, we updated the application to ask more key questions in regards to diversity. We also scored them slightly different based on that as well. And as a result of that, we have expanded our board to be more inclusive of individuals, added additional seats to include individuals representing LGBTQ, individuals from minority organizations, and other cross-sector systems that otherwise did not exist. One of our main accomplishments this year is a Continuum of Care strategic plan. I'd be remiss if I did not mention that. We have spent a year on this, engaging with consultants. It started with interviewing 14 key stakeholders, both internal and external, to ask them about our services that the Continuum of Care provides, and the Office of Homeless Services as the lead agency. That was then followed with the consultants coming into town and attending several homeless Congress meetings, and also conducting a survey with persons with lived experience to get their feedback. The third piece of that was creating preliminary findings, and they held 3 community workshops that were open to everyone. That was just this fall to lay out the key findings and get further feedback so that we can adjust. They're in the process of wrapping up that plan this month, and it'll be unveiled in January of next year. Phase 2 of that plan will include then the implementation plan. What are our strategies to move this work forward? Lastly, I'll mention on that, there were several 5 pillars that came from that strategic plan findings that will then have strategies. 1 is engagement and access. 2 is crisis housing. 3 is housing stabilization. 4 is income and benefits. And 5 is system capacity. And I'll move more quickly through the rest of these, but still important. Also listed on here, I have transition age youth supportive housing development. We have in 2024 our first youth young adult housing development, 50 units will be coming online. That's extremely exciting through a broad collaboration, as you can imagine, of Continuum partners. We've been working on a youth drop-in center for those primarily 18 to 24, but some below, and having that creative space that is youth-centric and meets their needs so that they're not having to enter the chaos of the rest of the system. We have workforce development and income stability work going on. This is extremely exciting. OHS has partnered with Enterprise for quite some years, but we've had increased and intense involvement from our office's standpoint over the last year to where we've created a steering committee to look at workforce and employment. We're doing this with Paul Bounds and Enterprise. Great example of an internal collaboration, I think, of forming a steering committee, looking at how does workforce overlay into the work that we do in the homeless system and vice versa. Ultimately, we'll hope to have a procurement go out to look for an administrator that could help track those referrals and increase earned income with those that are experiencing homelessness. Youth Homeless Demonstration Program, Coordinated Community Plan. This is extremely exciting. After 5 years of applying, we've been awarded $4 million. 2-year grant, it will be renewable, so that's extremely exciting. So the next 6 months, it's an intensive process. It's due in April. We will have to formulate a coordinated community plan of how those dollars will be used to address the needs of the young adults in the community. And then, not surprising to you, last on here, but not least, is Cuyahoga County's shelter model transformation. As you've heard throughout the last year, throughout the pandemic, we've learned that should you deconcentrate a shelter and create a less chaotic environment, provide someone a more individualized living space, they're able to better work on their housing plan. And more importantly, it's more humane and it's more dignifying. And we've been blessed that some of the funding that has come in through ARPA with the county's approval and through home dollars really were meant for capital, or that was an eligibility that we don't always see. So some of our buildings need some love, and you'll see as we present our ARPA proposals that capital request is in there. And I should also mention, just going back to budget for one quick minute, the $48 million total on there that was listed that we're responsible for procuring, contracting, and monitoring. With the additional ARPA and the YHDP, our office will be responsible for $68 million. Looking forward and wrapping up, just wanted to mention some of the highlights that you're going to hear as we continue to work together next year. We'll have the unveiling of the Continuum of Care Strategic Plan that will be in January. We'll have the Phase 2 that I mentioned. The YHDP will quickly wrap up in April, so that's continued from the previous work. We'll continue the workforce, the shelter transformation as well. 2 new pieces that you'll see coming is, in addition, so the Youth Homeless Demonstration coordinated plan will fold into our strategic plan. This all needs to align. In addition, we have a focus on unsheltered homelessness in our community. So our consultants are going to be leading and facilitating that plan that will also fold into our strategic plan. Lastly, we are looking at redesigning the way we do things. And 2 of the focus areas that will be top priorities next year are coordinated entry. They went mobile during the pandemic. So the question is, what have we learned from that? And how do we alter our services to meet the needs of the community today, not 2 years ago when we started that? And lastly, housing navigation redesign. We have a large affordable housing crisis in our community. However, our workflow still needs to be as efficient as possible based on the resources we have. So we'll be further examining what that looks like and how do we strengthen that piece of the safety net. There's a lot of information. I greatly appreciate your time today. We have a vision. I'm blessed for the strong continuum that we have, and I look forward to sharing future successes. Thank you.
Next, we will have Community Initiatives Division, Office of Reentry, Simeon Best, Director. Welcome.
Good afternoon, Council.
Good afternoon.
Thank you again for this opportunity. My name is Simeon Best. I am the Director of the Office of Reentry. And I want to just make sure that we understand the importance of the Office of Reentry. In Cuyahoga County, well over 4,000 individuals return to our home every year from local jails, from state and federal prisons. Reentry is a broad term and used to refer to this transitional process of individuals returning back into their respective communities. This process is often difficult and poses challenges because although they have paid their debt to society, many of these people are consistently faced with barriers stemming from their incarceration. These barriers include the inability to secure employment, stable housing, adequate health care, quality education, and even just the right to vote. So the Office of Reentry was established in 2009. Did I do like Melissa and turn it off? Makes sense. Thank you. So established in 2009, the mission, the Cuyahoga County Office of Reentry is committed to strengthening a network of community partners by coordinating innovative programs and services that assure quality opportunities needed for successful reintegration. So what do? The Office of Reentry serves as the funder, collaborator, and convener in the reentry space. The office ultimately seeks to organize an ecosystem of providers, funders, and policymakers that work to increase visibility, efficiency, services, coordination, and opportunities for returning citizens. In regards to the programs that we offer to the community, I have these programs listed. Aspire Greater Cleveland is operated by the Cuyahoga County Library System. They have been contracted to provide basic adult education for detainees at the Cuyahoga County Jail and the McDonald Center, is a community-based facility, correctional facility. Their goal is to provide high school equivalency test preparation and administration. Individuals are prepared to take and pass the GED exam and to increase their math and reading skills by at least one grade level. The North Star Neighborhood Reentry Resource Center is our one-stop shop for all things reentry, and I'm sure you all are familiar with that. It's an innovative resource center that helps individuals who have been involved in the criminal justice system navigate social, housing, and economic barriers when they return home. A range of services are provided, including job readiness classes, employment services, computer training labs, GED classes, alcohol and drug substance abuse meetings, faith-based programming, vouchers for state IDs and birth certificates, free healthcare screenings, and bi-monthly support for individuals needing child support modifications. These services are available not only to returning citizens, but also to their families and to friends, because usually they're the strongest support system. The adult transitional model. This is run by North Star as well and provides services and linkages to individuals returning to Cuyahoga County prior to their departure from prison. Again, the case managers from North Star run this, and pre-release services are conducted for men and women who are within 6 months of release from prison. Achieve staffing. This will place and support job-ready reentry workers in competitive, temporary, and temp-to-hire jobs. Achieve staffing will help individuals with a criminal record achieve their job and career goals while satisfying employer needs for qualified, reliable workers. Then we have our Second Chance Reentry Law Clinic, and this is a partnership between the Office of Reentry and Case Western Reserve University and even other partners to provide a legal clinic for returning citizens. The clinic will provide the following assistance: assistance with court debt, assistance with record sealing, the Certificate of Qualification for Employment, CQEs, eviction, housing, and employment issues caused by criminal records, and many more services. And we do have enterprise community partners. So that's our justice housing. And we've contracted with them to lead a comprehensive justice housing planning process that will include a continuum of strategies, including but not limited to increase access to public and private housing market. There's more information on that, but the enterprise will build upon previous studies by developing an inclusive, affordable planning process that meaningfully involves returning citizens. They are our expert subject matter experts, and so we want to make sure that they are included in this process. Then you are familiar with the Going Home to Stay Guide. It's a comprehensive resource guide of services and providers to assist returning citizens, beginning pre-release and continuing post-release for those recently restored citizens. This resource is intended to help achieve the long-term goals of reducing recidivism, increasing public safety, and strengthening families and communities in Cuyahoga County. And so the next ones are just some of our events that we put forth, our job and resource fairs. We make sure that this is happening. The expungement clinics as well are events that we promote in collaboration with many of our community partners. These events occur throughout the year and are well attended by residents who are in need of the services. Also wanted to mention Reentry Week, which happens every year. It's an annual event at the last week of April. And again, it's along with our partners, we celebrate the successes of returning citizens, at the same time highlighting the continued barriers that returning citizens experience and ways to make sure they have a successful reintegration. So the Office of Reentry, like it's been said before, it's a small but mighty team consisting of 6 full-time employees. We have a total budget, a yearly budget of $2.7 million. Also want to just acknowledge, and we are proud of the fact that we applied and recently received a grant award for $1 million from the Bureau of Justice Assistance for a Pay for Success program in reducing recidivism and achieving housing, education, and employment advancement among restored citizens here in our county. And lastly, just wanted to uplift the community partners and organizations that are committed to the overall success of restored citizens. The Greater Cleveland Reentry Leadership Coalition is a combined reentry task force of city and county government officials and other public, profit, and nonprofit stakeholders. The goal of the coalition is to use its collective knowledge, skills, resources, and influence to advance the needs of returning citizens. Thank you for your time, and again, really appreciate this opportunity to present to you the Office of Reentry.
All right, thank you. Thank you, Director. The next one, we're coming down to the last two. We'll have the Office of Child Support Services Director Tiffany Dobbins-Brazelton. Welcome.
Before Tiffany presents, I do want to acknowledge there was a miscommunication in the presentation. So a version of her presentation was sent over just a bit ago. It's on me that we just crossed paths a little bit, and so we'll provide an updated version following today's presentation. Thank you.
Good afternoon, Madam Chair and council members. Thank you for the opportunity to talk about child support. I'm a little taller here. So thank you for the opportunity to talk about child support today. And so I'll start with thanks, Simeon, for saying it out loud. Now I know which button to press. All right. The Office of Child Support Services, or OCSS, is a 4D agency responsible for the establishment, collection, and maintenance of child support orders, as well as paternity establishment. We serve over 137,000 children and their families in Cuyahoga County. OCSS focuses to remove barriers to paying child support by working with various populations, including victims of domestic violence, the homeless, incarcerated or reentry, caretakers, and more. We work to support individuals in gaining access to additional challenges such as work and job skills. So I just want to talk a little bit about that today. And wanted to talk about the impact of child support. So apparently, obviously, to most, we're just seen as a collections base, and that's all we do. And that is important. The bottom line of collecting money for the families that we impact is important, but there's a lot of work that goes into that. Child support is a complex and complicated program, and so there's a lot of services that we have to put in to get to that bottom line. And it's not just collections that we do. Paternity establishment is very important and significant too. And so I just want to talk about a little bit about that. In terms of establishing paternity, why is that important? By establishing paternity, a father gains the right to seek custody and parenting time, and the child gains their identity, certain legal rights and privileges, as well as inheritance rights. And we see a lot of cases happen in which somebody passes away or that's not established, and unfortunately a child is not able to gain what should be rightfully theirs. So we want to further communicate and enhance this knowledge upon the community as we move forward. Also, we talk about establishing child support orders and medical support orders. We also modify or make review and adjustments, as Simeon had mentioned, to child support orders and medical support orders. We also do a lot of case management services, including the collections of payments, linking parents to employment opportunities, community and governmental services, enforcing orders, and locating parents. That's all a part of the work that we do, again, to get down to what often is perceived as the bottom line. There's a lot of education and outreach about the child support program that goes into our work. Annually, we have an employers workshop that is often modeled by a lot of the counties around the state, including the state office themselves. We're very proud of that. We want to connect with the employer community, and we want to continue to do that type of engagement to different communities within the state or that help with the child support program to provide this service to families. We are limited by federal mandates on what services we can provide directly through OCSS, and that's why we work hard.
We're not advancing on the screen.
Yeah, because she's the only one not pushing the button.
But how did I go back? Okay, so I'm not talking about those stats yet, Councilman. But, so we're limited by federal mandates, as I was saying, on the direct services we can provide directly through OCSS, which is why we work hard to link parents to other opportunities, whether it's employment opportunities. So we participate in grant work or whatever kind of work with local community partners to get things done. So one of the grants we had previously worked in was Families Forward demonstration. And we wanted to not just give payers the opportunity to get a job, but careers a career path and actual skill sets. And I'm also excited that we were recently named as a participant. The state office was awarded a grant, but we are one of 2 participant counties for the SAVES grant. It's Safe Access for Victims to Economic Security. So a safe way to collect child support. So we are very excited. It'll be a 5-year grant, and you'll be hearing more about that. We also work with a lot of our sister agencies because a lot of their clients we impact them and vice versa. Prior to the pandemic, the Ohio Child Support Program impacted more children than any other public program besides public education. Now, how that has evolved since the pandemic, I'm not sure, but that's how important we are to the community. So I'll talk about some of these stats now. And I'm not going to read to you, but this is something we have every year too, Child Support Awareness Month, and that's in August. And so these are some of the statistics that we share with our staff in comparison to Ohio and how we're doing. So you have over, 1 million children that are served by the Child Support Program in Ohio. And then we have over 127,000. And so, like I said, I'm not going to continue to read to you, but you see how many custodial parents we serve, how many non-custodial parents we serve. And also, when I talked about paternity establishment, that is a free service. And individuals and people should know that, and we want to get that word out. We also serve third-party caretakers. And so that's what I was going to say. We work with a lot of our sister agencies. So we work with the homeless population. We have a caseload specific to Children Family Services reentry. We work with the veterans community because you have to have specific ways to meet people where they are and what those needs are. And we recognize that. Let me go to this next one. Okay. Also talked about, this one talks about our genetic testing and the number of paternities that we have established. We talk about the support orders that we've established in those numbers. There are a lot of things that I talk about federal mandates, but that we work heavily with the courts as well as our prosecutor's office. We do wonderful partnership with them, so I thank those individuals. But we also have a lot of administrative authority that we can go ahead and take action, and it helps with our efficiencies, and those changes have occurred over the years. And so I do want to take this opportunity to recognize my staff and appreciate all the work that they have done and the things they have done to hang in there, especially since the pandemic. We went through, like many, a lot of vacancies, and we're, I believe, on the road to recovery. And so I'm thankful for that and everybody who has participated. For those who have hung in there with us, though, and keep it going, I do appreciate it, and I think it's making a difference. And we still got a road to climb, so I want everybody to hang in there with us. And last but not least, here are some other actions that we take. So you see the interceptions, lottery intercepts, and our collections. So we typically collect, and our collections are down right now, but like I said, we're on the road to recovery. But we still collect over $200 million typically every year, and we're somewhere in the neighborhood $235 million to over $240 million typically. Okay. And one of the things we have focused on over the last couple of years, and we want to continue to focus on, is access to our services. That is very important. So, I hate to keep referring to it, but the pandemic did force us to work differently, to look at the way we serve people, to hurry up and make changes and adjustments. And we continue a lot of those practices. We continue to offer people a way to contact us by phone, but also looking at even our service hours, when you can come to the building, what's necessary to come to the building. Are there other ways for us to be able to service you? Are there other ways for us to educate the community on what's happening, how to do it, understanding that people are also limited in the ways that they can contact us. So we continue to work on that, and I think it's going well. And we also work with, as I said earlier, the courts. So we participate in whatever clinics that are out there. We do warrant recall programs because, again, we understand there are barriers and challenges, and so we want to meet people where they are, but we also want to continue to make this impact and have that collection or have that parentage established. So thank you for listening, and I appreciate the opportunities to present the child support program to you.
Thank you.
Okay.
And item J, Fatherhood Initiative, Al Grimes, Director. Welcome.
Grimes. I'm administrator of the Cuyahoga County Fatherhood Initiative, and I too want to thank the members of this committee for this opportunity. I want to welcome the new folks that are coming on board from the new administration, and hopefully the overview that we give will be beneficial for them. I've also given you guys additional folders that have some of the additional information on the program, specifically what they are, and the times and things of that nature. So and talking about the Fatherhood Initiative, and so if you look at the screen that says Fatherhood Conference, you say, wow, why are you talking about the Fatherhood Conference? Well, we just finished our 16th annual Fatherhood Conference last week. Fortunately enough, and I'm gonna thank Tyra Taylor, because we had some rough edges in going and trying to get a contract done very quickly with the hotel. Tyra was invaluable in the assistance she gave. So I just gave this presentation on the 16th to the community. So I said, I'm going to share the same information with the group today. Okay, so. Okay. The mission of Cuyahoga County Fatherhood Initiative is simple. It significantly increased the number of children in the county who grow up with a responsible father involved in their lives. This is critical, especially in today's environment. Okay, and the Fatherhood Initiative itself, we started in 2004. We're fortunate to be able to grow into probably the most significant fatherhood initiative in the state of Ohio, and have been recognized in some circles as a best practice model. I've had an opportunity to travel not only in the state, but around the country, talking about our particular model and explaining how a lot of other organizations can get a fatherhood initiative up and running. So we look at the Fatherhood Initiative, and we're trying to strengthen families by fathers being more engaged in raising their children. So you say, why Cuyahoga County? Why is it so significant in Cuyahoga County? Well, currently there are 59,000 single-parent with children under 18 in Cuyahoga County. 59,000. You say, well, what is that? What percentage of that of the total? It's 44%. 44% of children in Cuyahoga County are now growing up in single-parent households. And the reason I say that is because sometimes we think of things as fatherhood program or this as being a rich issue, a poor issue, a black issue, a white issue. It just exhibits that across the county, there's a lot of single-parent households. And with single-parent households, there comes some additional work that has to be done to make sure that both parents are staying involved, whether they're living in the house or not. So 45%, that's the largest county in Ohio for single-parent households. 4 goals. First goal is to promote the public awareness of fathers. We continue to get the word out to dads. If you are involved, stay involved. If you're not involved, get involved. You guys will hear our radio ads, see our billboards and stuff, constantly getting that message out. The second thing we try to do, we try to make sure that when fathers come to the county, they're treated in a father-friendly manner, the same as it is when a mom comes to the county, because sometimes, systems are set up the way they are, and so sometimes they're geared toward the mom as a residential parent, but we want to make sure that the playing field is even. The third thing is we fund fatherhood programs to help fathers meet not only the financial needs of their children, but the emotional needs. I mean, we can be there all day paying the bills, but when a father needs somebody to talk to, what are your skills in doing that? And then the reverse side is you can be there all day as best buddies and playing video games, but a child has to eat. So we have to have a difference of programs to meet both of those needs. And finally, we have a fatherhood conference that we talk about that was every year to celebrate healthy father-child relationships, because a lot of times in the media, all we hear is the negative. But we know there's a lot of fathers in the community doing exactly what they should be doing, and we want to make sure that they get recognized. So there's some additional research facts across the country. 40% growing up without a biological father. Okay, and children without responsible fathers, and this is key. Research has showed us that when fathers are involved, children are less likely to live in poverty, less likely to drop out of school, less likely to commit to do drugs, less likely to go to jail. All the research says that when fathers are involved, children live a lot more positive and productive life. And at the end of the day, that's what it's about, our kids.
Excuse me, I'm sorry. Can you make sure you're talking into the mic?
Oh, I'm sorry. Yes. And that's some more additional research facts about having an involved father involved. So look at some of the program objectives. What are we trying to achieve with the parents that we're involved in? So we want to build parenting skills of fathers so that they can co-parent better. We have employment-related services for low-income and custodial parents. We want to prevent premature fatherhood fathers, including teen parenting and second out of wedlock births. Reconcile fathers with their families. Facilitate cooperative relationships between mothers and fathers. One of the things that I've always had to say in the community, the Fatherhood Initiative is not an anti-mom program. It's a both parents being involved program. So we're also always talk about cooperative relationships. And finally, we provide activities such as the Children's Museum of Cleveland for fathers to be able to do some activities with their fathers. So the next slide are the programs, specific programs that we fund. We have a public awareness campaign that I talked about briefly where we're getting the message out through radio and billboards and those kind of things. Our Jobs for Dads program is the job training and placement programs, 4 weeks in the program and putting folks in the job. The Dads Count program at the Children's Museum of Cleveland, where fathers can go to the Children's Museum free. Rising Above program is another job training and placement program. Prevention of Premature Fatherhood program is we're going out to schools and we're talking about teens about not becoming a dad until you are financially and mentally ready. Our supervised visitation program at the Domestic Violence Center, which is now the Journey Center, has supervised visits for fathers and mothers if they cannot see their children under some other circumstances. But another key part of that program is a weekend exchange program, which reduces domestic violence. If parents are exchanging their children on the weekend and there's some violence every time one parent comes to pick up their child and the other comes to pick up, they can go to the Journey Center, do that exchange at the Journey Center, reverse the role on Sunday, and avoid a lot of that drama. Our Strong Fathers program at through Meredith Taylor is our 24/7 dad curriculum. Our boot camp for new dads. We have a boot camp for new dads at all of the hospitals in Cuyahoga County, where fathers learn how to handle a child safe. They learn about postpartum depression. They learn about reducing infant mortality, which is key in our county. You know, how for children to sleep alone on their back and in the crib. Then we have a 211 fatherhood line, and we have our Network for Success program through Towards Employment. The only reason I show this slide, and it talks about all of the programs along the bottom, it just shows the breadth of the programs that I was talking about. What we try to do is provide programs for fathers at every stage of their children's life. Our boot camp for new dads when the child is born. Our program with the Children's Museum for when there's toddlers. Our program in schools when children are teenagers and preteens. Our programs for teenagers through our Prevention of Premature Fatherhood program. And obviously programs for fathers when they're adults. Accomplishments, and I'll just run through a few of these. You know, since our inception, we've had over 30,000 calls from fathers to our fatherhood line in our office. We did a county audit of all of the departments to find out whether some of the departments were father friendly. We've continued to fund the programs that I talked about. And through our 16 fatherhood conferences, we've reached about 29,000 dads. Some of the individual things were, let's just say, for example, 3,674 fathers completed job training, 1,545 in jobs, 10,000 been through the boot camp for dads, 26,000 been through our Prevent Premature Fatherhood program. 11,000 visits between non-custodial parents and their children. Those are some of the individual programs. Another thing we've
Director,
done.
we do have a committee at 3.
Okay.
And so.
Okay, I'll cut
If
this
you
short.
can go right to the return on investment.
Yeah,
for
go to
us.
return on investment, the return on investment slide, where we talked about, we did an evaluation a few years ago, and we said, look, the money we had invested was $5 million at that time. What was the return on investment to the community? And the return on investment was about $121 million, based upon numbers that showed if children stay in school, if they stay out of the juvenile justice system, if they go on to college and things of that nature. So I just want to wrap up, and I want to say that in 2005, just to give you some perspective, we had 5,200 dads who went through our funded programs, another 18,000 who went through the Fathers Walk to School program, another 500 who went to our Fatherhood Conference, another 500 to our program at League Park. So in 2022, we've touched about 24,000 fathers and families.
Thank you, Director. Thank you very much. I want to thank all the directors for coming out today. As you see, we needed every minute and time for this. It is very much appreciated, all the work that you do every day, and your staff that are back at the office and did not get. It's also very important because we can see it live streamed. This is memorialized for the county residents as well, to become more familiar with each and every one of your departments that you work in on a daily basis on behalf of them. So once again, thank you. There's reception next door at the community room. This meeting is adjourned.